we're advising now and what we might see in the future, and that is particularly to the adults, but specifically also the children who've been shielding. This is a new virus. We're continuing to learn about its transmission, and that knowledge will continue to grow over coming years. At the start of the epidemic in the UK, using the information we had available and our best understanding gained from other respiratory viruses such as flu and SARS, we recognised that some people would likely to be more vulnerable to severe outcomes from disease than others. This included older people and those with underlying medical conditions, and those are normally the people who would have a flu vaccination each year. This clinically vulnerable group we advised to be particularly stringent in following social distancing guidance, and that recommendation continues. But senior clinicians recognise that for a small subset of the population there may be an even greater risk. So, for example, this would be those who may be on particularly high combinations of immunosuppressive treatments or where their disease was particularly poorly controlled. And this group, the clinically extremely vulnerable, were those that we advised to shield. Shielding doesn't alter the risk to an individual of illness if they become infected, but it does reduce the likelihood of meeting the virus in their daily lives. Now we're out of the peak of the epidemic in the UK, and estimated levels of community transmission and infection are back to those before shielding commenced. We're in a position to start relaxing the shielding advice over the next few weeks. We may well actually have some summer weather a little in our favour too, and therefore our advice to those shielding is to take some steps now to start coming back to a more normal lifestyle. This has been a very difficult and sometimes frightening period for people who've been shielding, and therefore to give people time to prepare, we're setting out the advice in a stepped approach. So first from July the 6th, which is a time period from when other lockdown measures have been eased, so we can ensure we're monitoring the epidemiology continuously, we're advising that people who are shielding may want to start meeting in groups of up to 6 people outdoors, including those outside their household. If you live alone or you're a lone parent, you can think of forming a support bubble with another household. Those in a support bubble can then spend time in each other's homes, including overnight. And then secondly, from August the 1st, we will pause shielding. We'll still be advising people to stay at home as much as possible and to minimise contact with others outside their household. But from August the 1st, our advice would be that people can go out to more places, see more people. This might include going to the shops, for example, or visiting a place of worship. If you do leave your home, you should continue to keep a safe distance from other people at all times. Regularly washing your hands for 20 seconds is still one of the most effective ways that you can protect yourself. If you're unable to work from home, from August the 1st, you can return to work as long as the business is COVID safe. When this programme started, we used a precautionary principle. New evidence is telling us that the risks for individuals are often more clearly due to a combination of factors in that individual, such as age, ethnicity, obesity levels, for example, as well as the medical conditions that they have. The Chief Medical Officer has commissioned work to ensure that should we need to step up the shielding programme again, we would have available a much more individualised way for you and your doctor to be able to understand your risk and to receive more tailored advice. The new risk assessment research methodology is being published today by academic colleagues led by Oxford University. In the future, therefore, those we advise to take action may be a slightly different group to those who shielded through this new disease peak. One group where this is particularly relevant is for children. As evidence has evolved, we've seen that admission to hospital for all children under 18 years old with COVID-19 is very low indeed. Only 36 children in the UK have been admitted to intensive care. Shielding guidance to date has covered a broad range of conditions and clinical vulnerabilities. We know that many parents have been worried about how they can protect their children, and they often carry a considerable burden themselves. Now we have new guidance developed by the Royal College of Paediatrics and Child Health, and this will help families understand who does and does not need to shield. Now we have more evidence, we can be much more specific about risk, and it's very likely that in the future, very few children will need to shield. The evidence the children's clinical experts have brought together strongly recommends that children and young people who are cared for just in primary care are very unlikely to need to continue to shield in the future. There is a group of children that exist who, due to their underlying conditions, may need to continue to shield. But over the summer, parents can look forward to discussions through routine paediatric appointments, and in the interim, we will be talking with your doctors and the Royal Colleges to ensure everyone has the right information. So for now, there is no need for parents to speak to their doctor immediately, and we will sort that information out in due course. For anybody with underlying clinical conditions, whether adult or child, looking forward and after shielding advice is paused, we would still continue to advise you to be careful. Keep your overall social interactions down as low as feels comfortable initially, whether at home or at work, and keep practicing good hand hygiene and good respiratory hygiene. And finally, I would just like to say a special thank you to clinical colleagues, particularly in primary care and specialists in hospitals, and all of their staff who've been working hard to support those shielding over the last 3 months.
Thank you very much indeed. Now, if you'll allow me, I'll take one more minute just to set